is Dr. Ragini from Jata Fertility Center, Gachipoli, Hyderabad. Let's know about IVF and IVF ICSI. So initially what is the common things between IVF and IVF ICSI is that for the females, for the eggs to grow, the entire stimulation protocol for both IVF and IVF ICSI is the same. The difference comes only when we are selecting the sperms, or when there is a sperm issue, then we will choose whether the couple has to be opted for plain IVF or IVF ICSI. So what are the baseline conditions that we go to opt an IVF ICSI is that when there is a low sperm count or when there is a poor motility and morphology in the sperm parameters, then these are the couples that we choose to go for IVF ICSI. So nothing differs for the stimulation of oocytes, so we are concentrating mainly on sperms. So IVF is near to a natural selection of sperms where the eggs or the oocytes, once aspirated, are put within the pool of the sperms. There is a natural selection of the egg, there is a natural penetration of the sperm into the egg, and there is a natural fertilization and later the embryo formation. But when we come to IVF ICSI is that these sperms, whatever we choose or whatever we select, is by another selection methods where we tend to choose the morphologically looking normal sperms. When we say morphologically is that just by appearance, when its head, neck and the tail, the parts of the sperms which morphologically looks normal are selected, and then these sperms are then injected directly with a small needle into the egg. Means that we are facilitating the fertilization to happen in IVF ICSI when there is 100% fertilization rate when it comes to IVF ICSI. When the rest all parts after fertilization is the same again, that is embryo formation up till 3 to 5 days based on the conditions of the couple. So who are the mandatory couple where we have to go with IVF ICSI is that when there is a type of condition called as azoospermia, where there is a in-depth another classification in azo is a non-obstructive azo. In these kind of couples where we actually remove the sperm from the testes, and then these sperms which are not usually motile, we don't know we cannot subject these sperms for the IVF. So these sperms are the conditions definitely for IVF ICSI. Means surgical extracted sperms are definitely for IVF ICSI, and the other conditions are previously failed IVF, or also the couples when we go ahead with IVF ICSI in the next cycle, because once we get past through the fertilization rate, then the amount of embryos that we obtain is more, therefore the success also becomes more. So any conditions having low fertilization issue or previous conditions like any male factors like infections or previous surgeries, where there is again like in conditions like chemotherapy where there is again a drop in the sperm counts, then these are the couples when we opt for IVF ICSI. To know more, follow us. Thank you.